In this video, we're taking a look at the metacarpal hand. So type 1 metacarpal hand, in that the thumb is preserved, whereas all the fingers are amputated below the middle of the proximal phalanx. So when I say below, it's like below, not in the actual anatomical below. So the level of finger amputation may be used to further subdivide patients into subtypes A, B, and C. So in type 1 metacarpal hand, there are three types: 1A, 1B, and 1C. So 1A is when the level of finger amputation is proximal to the middle of the proximal phalanx. So the recommendation is to perform 2 second toes or a combined second and third toe transplantation. 1B is through the MCP joint, but with the intact proximal articular surface. So the recommendation is to perform a combined second and third toe transfer as a composite joint transfer. Type 1C of the metacarpal hand is when the level of finger amputation is proximal to the MCP joint. So the recommendation is to perform a combined second and third toe transfer. Type 2 metacarpal hand have all the fingers amputated proximal to the middle of the proximal phalanx plus a thumb amputation. So the subtypes A, B, C, and D, they depend on the level of thumb amputation and status of two important structures. These are the thenar function and CMC joint. Reconstruction of the fingers may be carried out concurrently or separately from the thumb reconstruction, depending on the subtype. So subtype 2A is when the level of thumb amputation is distal to the metacarpal neck. So the recommendation is to do a great toe transfer. Subtype 2B is when it is proximal to the metacarpal neck, but the thenar function is adequate. So the recommendation is to perform a preliminary procedure to lengthen the thumb, followed by a great toe transfer or a second toe transfer. A concurrent transfer of combined second, third toe or 2 second toes can also be done. Type 2C is when there is inadequate thenar function. So the recommendation is to do a 2-stage reconstruction along with opponentsplasty. Type 2D is when CMC joint damage is there. The thumb is reconstructed as an immobile post in this case. So we have type 1A, 1B, 1C, 2A, 2B, 2C, and 2D of the metacarpal hand.